Next, from the state capitol, we speak with State Representative Patti Bellock, a leading negotiator on the Medicaid reform bill, and hear some of the key issues included in the reform effort. This runs about 5 minutes.
State Representative Patti Bellock, you've been very instrumental in rewriting the Medicaid bill. Let's just give us kind of a quick overview. Just say, what does the state stand to gain by this rewrite, and are you happy with the way the bill is formed currently?
Well, it was a very heart-wrenching experience, and I think the state will gain from this, but what we're trying to do is to protect the most fragile population in Illinois, but at the same time to maintain the system, to restructure and redesign the system so that it can take care of the people it needs to take care of, 3.1 million people now, but at the same time address the issue of the cost of $15 billion, which is unsustainable at this time.
Now, the so-called SMART bill, among the things it would do is, as I understand, cut back hospital compensation about 3.5% for some of them. Do you know how many of the hospitals would be impacted by that?
Yes, there'd probably be about 130 hospitals that would be impacted by the 3.5 cut. And but at the same time, between the critical access hospitals and the safety net, those people, there's probably 75 of those that will have no rate cut at all.
What do you say to those in the Illinois Hospital Association and others that just say this is going to have a devastating impact on the operation of hospitals and some will close?
We tried to work with them. Remember, the governor asked us to make a cut of 8 to 9%. So we spent almost 4 months in those meetings trying to working out. We brought the Hospital Association in and all the other hospitals and asked them for their suggestions on better utilization, which they gave us. And you'll see in there are several things, especially the $40 million that they think they can save in readmission policies. That's huge.
To what extent is there any support in your caucus for a cigarette tax at this point? Is it still pretty hard against it?
I think that there's a lot of discussion going on right now, probably as we speak, coming into this room. So there will be discussion. There are some that I don't know if they can support it or not, but there's certainly a lot of discussion on it right now.
What about you personally? Are you prepared to support it?
I have never supported the cigarette tax in the past, but I'll be a part of this discussion that's coming into the room right now.
And what would you say as far as the Attorney General Madigan coming up with the charity care provisions? Do you question why this is coming up at the last hour when you've been working on this rewrite for so many months and perhaps probably over a year?
Right, absolutely, we have been. And I will say that that's why this bill is so important also, because it's driven these important discussions. So I think that's a good thing. To have something happen right at the last minute, at the last day is difficult, but at the same time, everybody feels the pressure that this is so important that they want to make sure it's done right. So that's a discussion that's very important to hospitals in Illinois. So the hospitals we've tried to include as much as possible in this discussion because they are the backbone of our economy. There are lots of jobs, but the main thing is they provide the critical health care to all of us. Oh, I'm sorry.
I got audio right. Hey, what's up with the Cook County waiver?
The Cook County waiver, as you see, has been eliminated from this bill, but that's not to say that it's going to be eliminated. It will be part of the discussion of the $2.7 billion.
And what about the standard rate for 120% for rural of the poverty line for rural care, as I understand it, and was it 200% of the poverty line in urban areas for qualification?
That's something that's been brought up in the Senate. We did not discuss that issue at all.
Would you support or oppose it?
I'd have to read that. I just heard about that like at 11 o'clock last night, so I'd have to take a look at that and see. You know, we're willing to work with everybody on anything. You know, our main thing is to address the issue of the Medicaid population in Illinois. How could we best serve them? How can we maintain and sustain the system to restructure? It's not only the Medicaid system, but the whole long-term care system within it, the rebalancing. It's extremely important.
Lastly, I was going to say, we're doing this to save the state money, among other reasons. How much money would be saved under these reforms, do you estimate?
Well, we feel we have gotten to the, $1.6 billion for sure that we have saved. But, with the others, those really are part of the package. They're not really the reforms and the cuts. So I would say if you had to add it up, you would come with $1.6 billion in cuts. But then when you get the other money from the cigarette tax and from the hospital rate cuts, you come to the $2.7 billion, which is what the governor asked us to do.
I mean, how much pain is this going to cause for poor Illinoisans?
This is a lot of pain, and that's why in that discussion, this is why it's taken us 4 months to work on this within the committee. And I'm telling you, we were asked to do a heart-wrenching process of taking a look at this, and we tried to not just put the money figure ahead of time, but we put the people figure of the fragile population, the people. So when you address especially the ventilator issue, what we tried to do was move that up so that almost every family could still remain on that, even though a lot of them did not meet the Medicaid eligibility. We do not want to see people suffer because of this bill.
And then lastly, on eligibility, are you confident that you're going to be tightening the system?
Oh, absolutely. That's probably the most historic part of the bill, is going out for the private vendor on the enhanced eligibility. And that was something I pushed very strongly, because unless we can take care of more people within the system, if we know that the other people in the system that shouldn't be there can be taken off the rolls, we can get more people who are fragile and need the services, and we can pay our providers, which, we rely on those providers. So what you're talking about with hospitals, nursing homes, doctors, podiatrists, chiropractors, everybody, they need to get paid, and they are almost 4 to 6 months behind in getting paid right now.
You're watching the Illinois Channel, an independent nonprofit corporation formed to provide gavel-to-gavel coverage of Illinois state government and other public affairs events taking place across Illinois.